Okay, so we will be browsing through the 79 pages of your IMCI because you already know the concept. It starts from assessment, then we classify, and then we identify what treatments are we going to do. After that, we are going to educate the primary caregiver. And then the last step is giving them pointers on when to come back for a follow-up visit and when to return immediately. And we will see it here as we browse through the IMCI. As I said, your IMCI is divided into two major halves. Okay, so the first is the first half you can see here from page 42, okay, up to 45 is your I call this the second half because this is 42 to 55. This is the part where if you have already assessed that your child is 2 months and below, so this is the part of the IMCI that we are going to use, 42 to 55. Okay, so if not, okay, if we have determined that the patient is 2 months at 2 months to 5 years, we are going to use the second half. Okay, what is the second half? Page 1, when to return, page 40. Okay, so we'll first browse through the first part, which is 1 to 40, which is sick child age 2 months to 5 years, and that begins in page 3. Okay, and we are going to follow para na makita nyo how do I do my IMCI. Okay, so I said it is similar to the books that you encounter in National Bookstore, An Idiot's Guide to Something Something. So here, An Idiot's Guide to Treating a Child 2 months to 5 years. Okay, so this is page 3. Assess and classify the sick child. Okay, so left to right. Okay, so we start ask. So I told you even the question to ask and things to assess, okay, are already here. Ask the mother what the child's problem are. Okay, so kumusta po? Why did you bring the child here in our center? Okay, initially we have to determine, is this an initial visit? So first time ba pumunta yung mother dun sa RHU, or is it because they went to the RHU because it's a follow-up visit? Okay, if it's a follow-up visit, then use the page, okay, that says follow-up visit. If not, if it is an initial visit, we are going to assess the child as follows. Use all the boxes that match the child's symptoms. Okay, so yan na. It tells you already what the instructions are. Once you have a patient, okay, who is 2 months to 5 years, initial, check for danger signs. Okay, remember, danger signs are present. Okay, initial interventions, finish your assessment as quickly as possible. Then bring the patient to the hospital. Check for danger signs. It tells us what to do. First, we ask, is the child able to drink or breastfeed? Okay. Does the child vomit everything that it breastfeeds? Has the child had any convulsions? So those are the questions we are going to ask the mother. Next, we are going to look. Okay, so assessment, observe, see if the child is lethargic or unconscious. So lethargic and unconscious, alam nyo na yan because we were able to see it in the video earlier. Is the child convulsing now? Is the child having seizures? Okay, so if any of this is yes, we go to the left to right. This needs urgent attention and it falls under red or pink or purple. So any danger sign, the classification is very severe disease. Okay, what are the initial interventions? Treat, give diazepam if convulsing now, give quickly complete the assessment to prevent low blood sugar, keep the child warm, refer urgently. These are the interventions na gagawin natin. A child with any general danger sign needs urgent attention, complete the assessment immediately, and any pre-referral treatment which is recommended in your IMCI, we try to do that as quickly as possible, okay, so that referral is not delayed. Okay, but again, if any danger signs are present, it doesn't say just do this and then rush already, refer urgently, because if you see the second bullet, quickly complete the assessment, it means that we still have to go to the next page. Okay, but we have to do it quicker than having danger signs. Okay, then ask about the main symptoms. Okay, assess again, does the child have cough or difficult breathing aside from the danger signs? How long? Okay, if yes, ask how long. Okay, this is what we ask the parent. Then it tells us what to assess. Look, listen, feel, count the breaths in 1 minute, look for chest indrawing. Alam niyo na rin to because we studied that earlier and it was discussed by your classmates as well. Look and listen for stridor and wheezing. Okay, so all of these are not new terms already for you. You already know how it looks because of the training that we underwent earlier. What is the pointer? Child must be calm. Okay, for this observation is accurate. If wheezing with either, you have a treatment here. Give a trial of rapid-acting bronchodilators, 3 times 15 to 20 minutes. Okay, count the breaths. Look for chest indrawing again. Okay, so we were able to count the number of breath. 2 months to 12 months, fast breathing is 50 breaths per minute or more. 12 months to 5 years, 40 breaths per minute or more. Okay, then collected data, classify cough as difficulty breathing. So with all the assessment, what are the signs? Okay, does the child have any danger signs? Is the child experiencing stridor when calm? If yes, severe pneumonia yung classification natin, or very severe disease. These are the treatments. Give first dose of appropriate antibiotic. Where are the appropriate antibiotics? They will be in the chart below, or severe disease. Okay, if not, kung walang danger signs, walang stridor, might fall under yellow. The patient has chest indrawing and fast breathing. So the classification is pneumonia. Look, all of the interventions nakasulat na dito. Okay, and we are going to write it down sa treatment chart natin, yung pinaserox ko sa inyo. Okay, I told you to have 2 copies for tomorrow because all of the treatment will not only be implemented, but we have to document it. Okay, dun sa mga pages na binigay ko sa inyo kanina, 61 to 68. Okay, so it is all listed here, but it is not enough to just do it. Okay, because being nurses, if it is not documented, if it is not written, it means that it has not been done. Give oral amoxicillin for 5 days. If wheezing disappears, give inhaled bronchodilator. If chest indrawing in HIV, I will skip that. Soothe the throat and relieve the cough with safe remedy. How do you soothe the cough at home or the throat at home? Warm water. Okay, gargle with light vinegar and a pinch of salt sa glass. Okay, it will soothe the throat. Calamansi, for example. If coughing for more than 14 days and recurrent wheezes, they refer for possible TB or asthma assessment. Advise mother to when to return immediately. We will see later, and then follow up in 3 days. How do we? What are the factors? Okay, and the mother must return immediately. Later you will see, like the condition does not improve. There becomes a high fever. Okay, so return immediately. Those are factors. But if there is no chest indrawing or fast breathing, there is no any danger signs. There is no stridor, okay? The patient may have no signs of pneumonia or severe disease, okay? So probably our assessment is cough or cold, okay? But remember, okay, the question here is the child is coughing already. The child is coughing. Assessment of this one falls here. Okay, so classification natin is cough or cold, and these are the treatments. Do we end there? Okay, so yes, may cough na po yung okay na po sir, because we diagnosed the patient has pneumonia already and treated already. Are we finished? Okay, not yet, because aside from assessing for cough or difficulty, despite the patient having cough, okay, we have to understand that the patient can have multiple classifications. So we do not end at this page despite having a problema. It is pneumonia. Okay, so because of the assessment that is positive here, meron na tayong classification. We already gave the interventions. Discharge na po yung patient? No. Okay, because we have to continue to the next page. Remember, this is a manual that we have to follow. So aside, possibly the child also has diarrhea. Okay, so we will assess, does the child have diarrhea? We ask the mother. Sabi na mother, yes. Okay, so it means that there is another classification in store for the patient. What are the things we are going to ask if the mother answers yes? Okay, so for how long is the diarrhea happening? 2 days, 3 days? Is there blood in the stool? Okay, may dugo po ba dun sa tae niya? Okay, ay wala po. Wala naman po kami napansin na tae, na dugo. Okay, then after the subjective questions, look and feel for the following. Look at the child's general condition. Okay, so alam niyo na, is the patient lethargic or unconscious? Restless and irritable? What else are we going to assess? Na kayang-kaya niyo na. Assess for sunken eyes. Offer the child fluid. So just like we saw in the video. Is the patient not able to drink or drinks poorly? Does the patient drink eagerly? Okay, is the patient thirsty? So these are all assessments that we can see. Pinch the skin. Okay, so yung skin turgor natin, does it go back? Is there tenting? Okay, very slow, longer than 2 seconds slow. Okay, so all of the data that we collected here now falls here. It goes now to the classification. Okay, classification on the type of the dehydration of the child. Classification if diarrhea is more than 14 days or more. Classification if there is blood in the stool. Okay, so first for dehydration. Okay, what is the classification of the child? As long as there are 2 of the following signs, the patient will fall under pink or severe. So is the patient lethargic or unconscious? Sunken eyes. Pinch goes back very slowly. If there are any two of this, our patient falls under pink. If our patient falls under pink, these are our interventions. If the child has no severe classifications, dehydration plan C, where do I see the plan C, sir? Go back to your table of contents. Makikita mo doon. You will see, ha? Dehydration. Diarrhea. Okay, so feeding for diarrhea. Do I see there? Okay, so plan C, treat for severe dehydration quickly, is located in page 20. Okay, so ganun yung gagawin natin. If we see something that we do not understand, plan C daw, ano yung plan C? Then I go back to my patient's, what do you call this, table of contents for 2 months up to 5 years. And it says here, okay, plan C, treat for severe dehydration, that is on page 20. We will see that later. Pero that is the flow. Okay, ganun yung gagawin natin. Browsing, that's why it's a manual. It's easier to have a manual. Ewan ko kung nakabili yung mga classmates yun na manual kanina sa where is that again? There, located in plan C. If not, if child also has another severe classification, refer urgently to the hospital with mother, giving frequent sips of oral rehydration salts on the way. Okay? Advise the mother to continue breastfeeding. If the child is 2 years or older and there is cholera in your area, give antibiotic for cholera. So you can see, ang galing ng IMCI system because it tells you available, sir. So possibly your patient will fall under yellow. Yellow, you must have 2 of the following signs. The patient is restless, irritable, sunken eyes, drinks eagerly, thirsty, skin pinch, goes back slowly. Okay, so our classification is some dehydration. Give fluids, supplements for food for some dehydration, or it is called plan B. Saan natin makikita yung plan B? We go back to the table of contents and copy the interventions. If child is also having severe classification, refer urgently to hospital with mother. Give falling under yellow, it is possible that we might, okay, urgently refer the patient still. Hindi lang po pala lahat ng pink. Okay, so here, even yellow. Okay, advise mother when to return immediately, follow up in 5 days if not improving. But if there are no 2 signs, not enough signs to classify as severe dehydration or some dehydration. Okay, so we classify it as no dehydration, but still we have some treatment because the patient has diarrhea. We still have diarrhea, but there is no dehydration. We give fluids to rehydrate. Zinc supplements suppress or stop the bacterial or viral infection. And the food to treat diarrhea at home, bananas, for example. Advise mother when to return immediately, follow up 5 days. That is just for your classification of dehydration. We also have to see if the diarrhea is more than 14 days. Is that possible? Yes. Negligence, probably. Okay, or ano yung mga factors na sinabi natin kanina? Possibly, they do not have money. They are intimidated to run to the health center kasi iniisip nila they will be paying. Okay, so let's try. Baka bukas gagaling na yan. Baka bukas gagaling na yan. Bigyan mo lang ng saging, painumin nyo lang ng tubig. Dahan nyo ng Gatorade. Okay, yung mga tipong gano'n. So they were trying to treat the diarrhea at home and it is now more than 14 days. Dehydration is present. It is severe persistent diarrhea. Treat the dehydration before referral. Okay, so depends. Can the infant or can the child drink? Okay, or kaya ba nating bigyan ng what do you call this IV line? Okay, if dehydration is not present despite diarrhea for 14 days, here our classification is persistent diarrhea. Okay, there is medication here. Advise mother on feeding a child who has persistent diarrhea. We will see that. So where do I see this? Treatment for persistent diarrhea. It is all in your manual. We will go back to the table of contents and it is listed there. Give multivitamins and minerals including zinc. Okay, so even for COVID-19, zinc is very recommended because it stops or it tries to control the viral infection in the body. Zinc with vitamin C. Okay, so makahanap kayo ng zinc with vitamin C. That is what we take. Give vitamin A, follow up after 5 days. No diarrhea for 14 days. What if there is blood in stool? Blood in stool is dysentery. Cipro. Magbigay na po tayo ng Cipro for 3 days. Follow up in 3 days. Advise mother to return immediately. Okay? So dalawa na agad. Possibly, as we are now in page 3, there is a possibility that our patient has 3 diagnoses already. It can be difficulty of breathing. Okay? It can be a danger sign. My child, at this point, there is a possibility that our patient already has 1 danger sign, possibility of a respiratory problem, then a possibility of dehydration because of diarrhea, or none, or 1, or 2, or 3. Okay, that's why do we stop? No, because it's a flow chart. We go then to the next. Okay, so pag hindi pa rin, or oo, either way, the next thing that we are going to assess is fever. Does the child have fever? Okay, is the question. I'll try to zoom in a bit. Does the child have fever? If yes, decide if the place is malaria risk. Okay, so is there malaria risk in their area? Okay, is there a history of malaria in the area? If none, no malaria risk. Okay, ask, does the child live in a malaria area? That's how we determine. Has the child traveled during the past 3 days in an area which has high malaria? Okay, then ask, how long have you been in that place? If for more than 7 days, has the fever been present every day for 7 days? Has the child had measles within the last 3 months? Okay, so ito yung mga questions natin that will be used later in our classification. Okay, look and feel, personal assessment, look and feel for stiff neck. Why again? Because it will tell us if there is a malarial infection, sepsis, okay, meningitis. You look for runny nose, look for any bacterial cause of fever. Okay, meron bang skin infection na notice kayo? Meron bang pus? Look for signs of measles. So how do you observe for measles? You saw it earlier in the Filipino child. Okay, so marami siyang discoloration sa mukha, mga spots, okay, mga parang mga reddish spots sa face, generalized rashes on the face. Okay, one of this, cough, runny nose, and red eyes. If possible, if the test is available in the center, let us do a malaria test. Okay, if we have, okay, it's a malaria test kit. If all fever cases in malaria, no obvious cause of fever in patient. If the child has measles now or within the last 3 months, look for mouth ulcers. Are they deep and extensive? Look for pus draining in the eye. Look for clouding in the cornea. So it can mean measles. Okay. So what classifications can be present for fever? First, classify if it is a malaria risk. Okay. It can be severe. Any stiff neck, danger sign, it can mean very severe disease. If the malaria test is present in the center and it tests positive, the patient has malaria, list down and implement this intervention. Negative, fever, no malaria, these are the interventions. Okay. No malaria, it can be, the fever can be caused by a febrile disease or it is a plain fever. These are the interventions. If we, based on the assessment, if it is measles, it can be classified as severe complicated measles, measles with eye and mouth complications, or green, just plain measles that you can treat with vitamin A. Okay, so multiple classifications can be present. The fever can also be caused by dengue. How will we know if it is dengue? These are the questions. Has the child had any bleeding from the nose, gums, or in the vomitus, or in the stool? Has the child had black vomitus? Okay, so black vomitus, it means it's coming from the stomach already. Okay, because the blood, it is bleeding in the stomach, blood acting with gastric acids. Okay, if it is it stays too long in the stomach, of course hindi yan lalabas na red. Okay, because it is digested blood already. So when the patient vomits, it is black, not red. Okay, if it is red, it can come from the throat, the esophagus. Okay, but stomach, it can be black or it can become red. Okay, has the child had black vomit? Has the child had black stools? Opposite naman for black stools. Okay, if the bleeding is coming from your rectum, if the bleeding is coming from the dulo, okay, dulo ng GI system, your large intestines, for example, if the bleeding is coming there, ang mangyayari, the stool will be red. Okay, blood in the stool will be red. Okay, because it is not yet digested. Okay, siguro pag upper colon, probably it can be red. Okay, but if it comes from the from small intestines. From the small intestines, the bleeding is there. What will happen? The blood will pass through the small intestines. The blood will pass through the large intestines to the rectum. It will come out as black. Okay, so yung kinakain nyo sa ihaw-ihaw, sa mga turo-turo na barbecue, di ba? Ang kulay ng dugo is black. Okay, because it has been digested, it has been processed. Okay, but if it is fresh blood from the stool, it is telling you that the bleeding is from the lower GI. Galing yan sa rectum, galing sa anus, galing yan sa large intestines. As the child had persistent abdominal pain, abdominal cramping because there is bleeding inside, as the child had persistent vomiting. Okay, so yes or no. Look and feel. Look for bleeding from the nose or gums. Look for skin petechiae, because there is already rupturing of the small blood vessels in the skin. Feel for cold and clammy extremities. It tells you that the circulation in the extremities is poor already, kaya nagiging cold. Ask none of above. Ask, look, and feel. Signs are present. If none of the above, ask or look and feel. Signs are present and the child is 6 months or older and fever is present for more than 5 days. Okay? Then perform the tourniquet test. Tourniquet test, put a tourniquet on the arm of the child. What will happen? Petechiae will come out kasi nagra-rupture yung mga blood vessels because of the tourniquet. Okay? If yes, classify as dengue hemorrhagic fever. It means that there are the following. There is bleeding in the stool, black stool, okay, cold and clammy extremities, tourniquet positive. Classification, severe dengue hemorrhagic fever. Do not give aspirin. Aspirin is an anticoagulant. It will further cause bleeding. Okay? Refer to the child down in the page 61 to 68. Okay, then do your intervention. Document, do your intervention, or do your intervention first, then document. No signs of severe dengue hemorrhagic fever. Okay, so unlikely. Just give the medications below. Give Oresol, okay, to rehydrate the child. Okay, water will decrease the temperature of the child. Advise the mother to return immediately if there is bleeding, if there is stool, probably. Okay, follow up in 3 days. Still do not give aspirin because aspirin is an antipyretic. Okay, but it is a side effect it's an anticoagulant as well. So wag nating bibigyan ng aspirin. Give paracetamol. Okay. Are we done with that? No, kasi meron pa. Other questions. Does the child have an ear problem? Okay. What are the things that I will ask the mother? Is there ear pain? Is there ear discharge? If yes, how long? Okay. I don't know if it was mentioned in the video. Ear pain is minor. Okay, but the problem with ear pain is ear infections are the #1 cause of deafness in children. Okay, and if left untreated, it can lead to meningitis. Okay, it can scatter kasi nasa ear na yan, malapit na yan sa utak. Look and feel. What are we going to look and feel for? Pus draining from the ears. Feel for tender swelling behind the ear. So how do you assess the ear? I don't know if it was discussed earlier by the third group. Remember yung pulling down, pulling up, pulling forward, pulling backward. Okay? So minsan kahit pulling down lang masasaktan na yung bata. Feel for tenderness behind the ear. Feel if it is warm to touch. Okay, those are things to assess if the child has infection. So compare it, both sides. Okay, nakatingin ka sa likod. Okay, bakit dito maga? Sa kabilang side, hindi maga. So probably there is infection in the swollen side. Classify the ear problem. If it is tender swelling behind the ear, give mastocytitis. The classification is mastocytitis. Antibiotics, paracetamol, and refer urgently to the hospital. Pus is seen draining from the ear, less than 14 days, and there is ear pain, acute ear infection. Give antibiotics and treat. There are 2 yellows here. Pus is seen draining from the ear. Discharge is reported for 14 days. Chronic ear infection already. Less than preventions. Dry the ear by wicking. Treat the topical. Treat with tropical quinolone ear drops for 14 days. Follow up in 5 days. Lastly, if all of these are not present, there is no ear pain, no pus draining from the ear, there is no infection, so no treatment. Okay, that is our going to assess. Di pa natin itatakbo yung bata? No. Sabi, do the assessment quickly and finish everything. Next, we are going to assess for malnutrition, and it was discussed by your classmates already earlier. Determine weight for height, weight for length, the Z-score. We will see the chart later for Z-score. Measure for MUAC. Okay, child is 6 months and older. Nutritional status. Okay, so nandito yung mga danger signs, classifications. Classify again. Is there edema? Okay. Any of the following? May breastfeeding problem. There is complicated, severe acute malnutrition. These are the treatment. If weight for height, weight for length is less than -3. What does this mean? I will show you later. Okay. -3 means severe malnutrition already, severely underweight. Okay, because that's 0, 1, 2, 3, 0, -1, -2, -3. Okay, so makikita nyo later that there are 6 levels for that. Again, classify are here. Assessments are here. Classify, tapos do the same thing. List and do the intervention. For checking for ear infection, we check for anemia. We classify the anemia. What are the questions? Palmar pallor. Okay, so ito yung nakita nyo kanina. Some pallor, severe palmar pallor, no palmar pallor. Okay, so difference. HIV infection. Okay, so medyo complicated. Okay, ask the mother if the mother has or child has HIV test, serological test, virological test. Okay, if positive, if negative in our country. Are we done? Not yet. Okay, so yung reporting ng last group, check for immunization status. And we call this, the questions were given earlier, okay, by the last group. Okay, yung mga i-discuss, yung mga what we call this, the things to assess sa vaccination. Vitamin A supplements, routine deworming, give mebendazole, albendazole, so antiparasitic drugs every 6 months. Write it down in the vaccination book, and oral health. Okay, so check for the dental cavities if you have a doctor or a dentist in the health center. Okay. Assess any other problems. HIV again, I will skip through that. Treat the child. Okay, carry out treatment. Okay, so if we're done with the assessment part and classification, okay, nandun na tayo sa treatment. Okay, carry out the treatment identified after the assess and classify chart. Okay, so give oral antibiotics. Do we have this on our list? It is in here already. Okay, this will be given at home. Okay, also follow the instructions listed with each drug dose table. So dito natin titingnan the dosage that we are going to give initially and the dosage that we are going to teach, okay, the mother. So pag sinabing we are going to give, so if the patient is positive for pneumonia or acute ear infection, so one of the treatment listed earlier was give oral amoxicillin. Identify the age or weight, okay, and the dosage is here already. What do we have in stock in our clinic? Is it drops or suspension? Okay, so bibigyan natin ng different dose. Okay, if our patient has been confirmed for needs cotrimoxazole, okay, so for pneumonia, for example, or any infection listed on top. Okay, so what is the age? If less than 6 months, suspension. This is the dose. Okay, we do not give suspension to adults. Okay. Kaya bibigyan natin ng half tablet of this for 6 months to 5 years. Okay, dysentery medication, Cipro, the age again listed. Teach the mother to give oral drugs at home. Okay, follow the instructions below. Okay, so when you're giving educatives to the mother already, and hindi naman tayo nagmamadali if the patient falls under yellow or green. But remember, if it is pink, do the assessment quickly. Yeah, based on our IMCI system, ito yung medications natin. If the mother teach the mother how to give oral drugs at home, follow instructions for malaria, iron for anemia, paracetamol for fever or ear pain, treatment for what's this, PF and PV infection. So if we need to give these medications according to the IMCI manual, it is all written down here. Micronutrient powder is given as supplement for what we call this, malnutrition. Teach the mother to treat local infections at home. Explain to the mother what treatment is and should be given. Okay, if the patient is coughing and there is we want to soothe the sore throat, ito yung mga recommendations natin. Breast milk, breastfeed the infant because breast milk has natural antibiotics. Calamansi juice, increase fluid intake. Do not give cough syrups or mucolytics. Do not give decongestants. Okay, so yan yung mga bibigyan natin. It's all here. If we need to give vitamin A and mebendazole, albendazole, especially for patients who have parasites, explain to the mother why the drug is given. Ma'am, because we are suspecting na masyadong matagal na yung last time na nagbigay kayo ng pampapurga. Okay? And in terms of our nutritional assessment, the IMCI says that there is possibility that your child has worms. Okay, may bulati po yung anak niyo. Kaya tayo magbibigay ng vitamin A and anti-parasitic medications. Okay, mebendazole, albendazole. Treatment is here. Okay, and the dose is here for vitamin A. Worm, wickworm. Okay, so yan yung mga ibibigay natin. The instructions are all in your manual. Give these treatments in the health centers only. Okay, if it is available. Remember, if your patient is convulsing, give diazepam. Okay, inject, turn aside to clear the airway, avoid putting things in the mouth. 0.5 diazepam in cigar, give oxygen and refer. If unconscious, stop 10 minutes. So ito yung mga age, weight. This is the indication. Intramuscular antibiotics, okay, if it is present, ampicillin, gentamicin, benzylpenicillin. So depende sa age, depende sa medication, depende sa dosage. Oral quinine for malaria. If your patient tests positive for malaria, nandito yung treatment natin. Is that for sugar? Wait lang let's go back there. Yeah, okay. One thing that we can assess is the child having low blood sugar. Okay, so how do we do that? Of course, we are going to test the blood of the child, and meron tayong blood glucose machine ideally. Okay, you might strip. Thus, if the child is able to breastfeed, ask the mother to breastfeed the child. Okay, low blood sugar, tas naka-breastfeed, mag-breastfeed yung bata. If the child is not able to breastfeed but swallow, give expressed breast milk. Ibig sabihin, mag-draw kayo ng breast milk or breast milk substitute formula. If neither are these are available, desperate, give sugar water or 30 to 50 per ml of milk or sugar water before departure. Why departure? Because we are rushing the patient to the hospital. If the child is not able to swallow, okay, NGT if possible. Nasogastric tube if available, give 1 teaspoon of sugar moistened with 1 to 2 drops of water. Make the sugar water dissolve 4 teaspoons of sugar, 20 grams. So give extra fluid for diarrhea if the patient is present for diarrhea. Ito na yung sinasabi natin kanina, plan A, plan B, and plan C. It depends what type of dehydration. Okay. Give extra fluid for diarrhea. Okay. For treatment of malnutrition, give ready-to-use therapeutic food kung meron. Okay. Marami. Antiretroviral drugs, still for HIV. Take the child for HIV. Okay, so what is this? Okay, for follow-up. Okay, so magkaibang follow-up and when to return immediately. What we will see here. Okay, for example, if the patient is positive for pneumonia, okay, so sabihin natin, ma'am, ang follow-up niyo po is after 3 days. Please come back after 3 days. Ask if there are few, when the patient comes back after 3 days. Okay, remember, one thing to assess, is this a follow-up patient or this a initial admission patient? Are there fewer stools? Follow-up patient, is there less blood in the stool? Treatment is also here during the follow-up. Okay, so none. When to follow up? When should you come back? Malaria. Okay, if fever persists, please come back after 3 days. Okay, if not, maybe it's under none. Okay, if fever has been present, if the patient has diarrhea, come back after 5 days. The patient comes back after 5 days, what will be asked? Has the diarrhea stopped? How many loose stools is the child having per day? Okay, treatment is still there. Remember, if the patient is still experiencing diarrhea, we have to go back to the chart. Give follow-up care for acute conditions. So feeding problems, come back after 5 days. Anemia, come back after 14 days. Acute conditions, okay, moderate acute malnutrition, come back after 30 days. Okay. Okay. Counseling the mother. Okay. All children age 6 months with severe malnutrition. I will show you the severe malnutrition later. Feeding counseling. Okay. If there is problem with the breastfeeding, so these are the things that we are going to teach the mother. How many times do they breastfeed? Ideally, every 2 hours. Do you breastfeed during the night? If the child demands. Okay, pag umiyak yung bata, nagutom, yes, ideally you do. Feeding counseling, you have here already. Okay, so this is page 37. Okay, so different educatives. Okay, pag malnourished yung bata, we need to teach the mother. So look, health teaching dun sa mother. Feeding counseling depending on age. Okay, birth up to 6 months, 12 up to 2 years, 2 years and older. Teach. And those are the things we are going to teach. When to stop breastfeeding? Stopping breastfeeding means changing from all breast milk to no breast milk. Okay, so what age is it applicable? So we go back to the chart earlier. Feeding recommendations for a child who has persistent diarrhea. It is all written here as well. Okay, mother the mother. Extra fluids and mother's health. Okay, if the child is sickly, breastfeed longer. Counsel the mother about her own health. If the mother is sick, provide care for her or refer for help. Baka naman siya yung kailangang i-confine. If a mother or anyone in the family is smoking, advise, okay, to stop smoking. If she has a breast problem, okay, engorgement, sore nipples, breast infection, lalo kapag mahina magdede yung bata. Okay, malakas magdede yung bata, so lalakas din yung pag-produce ng breast. Suddenly, nagkasakit yung bata. What happens is the breast is continuing to produce a lot of milk. Okay, so it will engorge, it will swell. Okay, it will be painful. The problem is hindi na nagsasak yung bata kasi may sakit yung bata. What will happen? There is engorgement, sore nipples, breast infection. So provide care for her or provide help. Advise her to eat well, to keep up with her own strength and health. Check the mother's immunization status. PT, if needed, make sure she has access to family planning, counseling on STD and AIDS prevention. Give additional counseling if mother is HIV positive. Okay, so mother-to-mother concepts. Okay, so ito shortcut to. Because when to return, ang meron lang dito sa page na to is specifically the date. Remember, dun sa taas, when to return, tapos meron mga interventions. Here is specifically for the days lang. Pneumonia, dysentery, malaria, return, follow up kayo after 5 days. Feeding problem, anemia, 5 days, 14 days. Okay, so mas specific itong chart na to in terms of days kasi yung nasa taas may interventions pa. What is the difference of when to return for the follow-up visit and when to return immediately? Okay, so the patient goes home today already, okay, but suddenly the child does not drink or is unable to breastfeed, balik po agad kayo sa clinic. Okay? Mas lalo nagkasakit yung bata nung umuwi, come back to the center. Walang fever, pero nung pagka-uwi, 1 or 2 days after, the child developed a fever, come back immediately. Okay, so ito yung difference ng follow-up visit to when to return immediately. The child has diarrhea, biglang pinauwi na natin because we already classified it as yellow or green. Okay, but when they went home 1 to 2 days after, there is blood in the stool, the child is drinking poorly, return immediately. Okay, so now you know the difference of follow-up visit and when to return immediately. Okay, I think that is for the first part. This is already the second part. Sick young infant 2 months and below. If you go through the questions, it is different. Okay, suddenly we remember dun sa taas, the first thing we check after checking for danger signs. Okay, wala. Okay, dito we're not checking for danger signs. Immediately, if the child is 2 months and below, check for severe disease and local bacterial infection agad. Okay, so we are not looking for danger signs. Okay, but we are looking for this already. Not feeling well, convulsing, fast breathing, severe chest indrawing, okay, breathing, convulsions. Look, listen, feel, count the breath. Look for severe indrawing. You know this already. Measure temperature, fast draining, skin pustules. Meron ba mga uka? Okay, sa skin niya. Meron ba mga pustules? Look at the infant's movement. Okay, infant sleeping. Is the child conscious, unconscious, responsive, unresponsive? Does the infant not move at all? Okay, movement only when stimulated or no movement at all. Severe disease. Give the first dose of IM antibiotics. Low sugar. Prevent. Refer urgently to the hospital. Advise mother to. Last hour, 2 years, 2 months. After jaundice, we check for diarrhea. After diarrhea, okay, weight. Check for feeding problems. Low weight for infantus. Next, treat and counsel. Okay, so ito na, medyo mas maiksi yung mga treatment for 2 months and below because nandito na tayo sa treat and counsel. So if there are medications, okay, how to treat the young infant for low blood sugar. Treat the young infant, what's this? Appropriate antibiotics, of course, iba yung dosage. Treatment at home. Okay, treat the young infant is HIV already, so we'll skip it. Okay. Educatives for mother regarding breastfeeding, how to express breast milk, okay, how to keep the low weight infant warm at home. Counsel the mother. Okay, so same as our 2 months to 5 years. Okay. Advise the mother to give home care for the young infant. Okay. When to return. If the infant has, okay, for follow-up visit. So very mabilis, no? After 1 day, if jaundice, return tomorrow. We will observe again. Bacterial infection and diarrhea, please come back after 2 days. Okay, so iba, mas aggressive yung treatment natin kapag 0 to 2 months. When to return immediately. Advise the mother to return immediately if the young infant has any of these signs. Biglang mahina yung breastfeeding, reduced activity, mas nagkasakit, develops a fever, unusually cold, shivering, fast breathing, difficulty breathing, palms and soles of feet appear yellow. Return immediately. Follow up. So bumalik yung patient mo. Okay, so these are the things that you are going to follow. Patient has jaundice. Ma'am, please come back after 1 day. The patient comes back after 1 day. Look at the jaundice. Are the palms and soles yellow? Treatment, okay, refer to the hospital. If the palms and soles are not yellow anymore because of the treatment that we did above, decreased, okay, follow up again. Ma'am, balik po ulit kayo bukas. If jaundice has started decreasing, reassure mother and ask her to continue home care. Ask to return after 2 weeks of age. If jaundice continues beyond 2 weeks of age, I think this is more on a newborn child. refer the young infant to the hospital for further assessment. 8, follow-up check-up for infant. Thrush, come back after. Okay, annex. This is not already included sa, what do you call this? Sa 2 months and below. Okay, but you already have. Okay, so we have pictures. Okay, prurigo, hearing worm tinea, scabies, ganyan ang itsura. Okay, so even for assess zoster. Okay, impetigo. Sino na nag-herpes zoster dito? Okay, so that is very painful. What do you call this? Basic or what do you call this? Simplified pathophysiology. If you do not, okay, usually when you have chickenpox, you develop antibodies for this. Okay, that's kaya walang tao na nagkakaroon ng chickenpox twice. Okay, so what happens if you do not develop adequate what do you call this? Immunization from the chickenpox, okay, despite having it already, it can be herpes zoster. Okay, so ito yung mangyari. Okay, and the difference of herpes zoster, it is very painful. Okay, so masakit yan. What is this? Impetigo, other skin problems, molluscum, contagiosum, warts, clinical reaction to medications on your skin assessment, eczema, fixed drug reactions, Steven-Johnson syndrome. So what do we see? Severe action due to cotrimoxazole. Okay, stop medication immediately. Okay, wait, what happened? Okay, so we are now in page 63. Bakit naging 63 to? Okay, this is 61. Okay, so dito sa contents na 61, you can see here. Okay, so ito dapat yung mga print nyo. Why? Because these are the forms that we will be filling up once we have a patient. Okay, once we have a patient, we have these forms, then write the name. What are the child's problems? Okay, no, dito muna tayo sa name, age, sex, weight, height, temperature, down. Then we have to assess, is this an initial visit or follow-up? Okay, so initial visit, check. Follow-up visit, check the date to date. Then assess, circle all signs present. So once we are interviewing and talking to the mother, okay, nandito. So it is really very easy to check. Check for danger signs. Okay, not able to drink, breastfeed. This is for 2 months to 5 years. So just encircle. Are the danger signs when selecting classifications? Okay, so sinusundan natin yan. Okay, does the child have difficulty breathing? So why is it like this? Because it is side by side already. We have our IMCI manual. Then beside it, okay, while we are going through the flip chart of our IMCI, ito yung nasa tabi. We are doing the checklist while interviewing the mother. Does the child have diarrhea? Does the child have fever? Printed, because this is what you are going to do tomorrow. Treatment. Once we are able to classify, assess, classify, meron ng color, nakalista na yung treatment. Isulat nyo lahat ng treatment dito. Okay? Remember to refer any child who has danger signs. This will serve as your documentation. Documentation of the things that you did to the child. Okay? Despite na nakasulat lahat dun sa taas, you can write that IMCI says, bigyan namin ng IV cotrimoxazole, but it was not available in the clinic. But you still write it down, then you note that this was not given. Mga tipong ganon. Write it all here. Why? Because this will serve as your endorsement form. Okay? Endorsement form, when you reach to the hospital, yan ang ipapakita mo. Endorsing patient Mika Javier was rushed to the Barangay Health Center earlier, and we noticed that he has difficulty of breathing, etc., diarrhea. Okay, so binabasa mo nilang yung endorsement form mo, then you will also give this form to them. If not, the patient is yellow or green, this treatment chart will be serving as the file of the patient in the health center. Okay, para alam mo yung, para may file or history file yung patient. Kasi sinabi mo, come back after 3 days, come back after 4 days. Okay, so what you did here. Art initiation recording form, HIV. So we are going to skip this, but you still have to familiarize yourself with it. Remember record actions here. Follow-up care confirmed. Follow-up care for HIV, we will skip that as well. Records action taken, form for 2 months and below. So assess first. Okay. What is the age of the child? If it is below 2 months, then after asking, ito yung forms na ilabas mo. This is the forms. These are the forms that you are going to fill up as you go through your IMCI. Ito na. Yung diniscuss ng last group. Okay, malnutrition. Okay, so you have here weight for age because we cannot measure the child. So birth to 6 months. Okay, we just have two axes here, X and Y. X is you have the weeks. What is the age of the child? Remember, sabi natin, this table, try to zoom out. Wage for age in girls. Okay, so maximum natin dito is 6 months. Okay, 3 and below is divided into weeks. So we assess, for example, I will annotate, format, the size. Okay, for example, we assess that the child is 4 months. Okay, and the weight is around 7 kilos. So 4 months and 7 kilos is around here. Okay, so 7 kilos, 4 months. Okay, if you can see, the child is above the green line. So the child can be closer to green, which is 0. Okay, medyo malayo siya sa 2. Okay, so the z-score will be around 0. Okay, what is the z-score? Ideally, ang target natin is 0 to 2. Okay, 0 to 1, 0 to 2. Why? Because 0 is the normal. Okay, green is the normal. Okay, 2 is above normal, 3 is above normal already. So this is malnourished, overweight. Okay, 2 is above normal already, 3 is overweight, severely overweight. Opposite naman dito. If the child is 4 months and sabihin natin ang weight lang niya is around 3 kilos. 3 kilos will be here. Okay, 4 months to 3 kilos, around that line. We are already very under -3. So it means that the child is very malnourished, undernourished kasi -3 siya. Hindi man na siya mabot na -2. Okay? She is even below -3, but the z-score is -3. Okay? So this is your weight for age for girls. So if the part of your IMCI asks for a z-score, that's how you get the z-score. The z-score can either be 0, 2, or 3, 0, -2, or 3. Okay? I will clear the annotation. Clear all drawings, cancel. Then I go to the next page. That's how you use your weight for boys, birth to 0, 6 months, birth to 6 months, z-score. Okay, so of course, magkaiba yung weight to age ng boys and girls. Mas malaki yung sa boys. So for example, 13 weeks, 12 weeks, okay? 12 weeks, and then, what do you call this? 12 weeks, and the child is around 4. 12 weeks and 4. So this is around here. Okay? 4 kilos, magaan pa pala. Okay? Wrong, here. Sorry. Okay, 12 weeks and 4. So I am -3. Okay, so ideally for 12 weeks, para makapag-0 man lang, dapat nasa 6 kilos yung bata. Okay, so 6 to 7 kilos. Okay, pag lumagpa siya ng mga more than 7 kilos, nasa 2 na siya. Okay, so that is the z-score of the child. So I hope you understood that. What if the child is birth for length? If we can measure the length, birth to 2 years. Okay, so it is here also. So what is the length of the child in centimeters? Okay, so 105 centimeters. Okay, tapos the weight is 4, 6, 8, 10 kilos, 12 kilos, 14 kilos, 16 kilos. Okay, ideally we should be around 16 kilos for 105 centimeters. Mga tipong ganun. Okay, for the z-score to be 0 or green. Birth to 2 years z-scores. This is again length to weight. Okay, so meron tayong a different chart for 2 to 5 years old. Okay, if this is 2 to 5 years old already, sabi ng isang group kanina, nakakatayo na ng bata, we can measure the height already. Okay, first, ideally we are at 20, 21. Okay, para maging at least normal yung bata. Then weight for height. The last parts around 77, 78, 79, these pages, these are the charts that you can use while teaching your patients, because some of the patients, even students like you, will respond or understand it easier if there are pictures. Okay, so for example, this part, ma'am, is not breastfeeding. The child becomes sicker. develops fever. So ang gagawin po natin when this happens, please come back to the clinic immediately. Okay, so these charts will help as your teaching guide, okay? Teaching photos. Okay? Bring the infant to the clinic if there is. Okay? Kung hindi nakakapag-dede na maayos, malamig yung bata, nag-shiver, pag may yellow, okay? Nag-yellow yung palms. Okay? One thing, you can also scan it and print a copy. Okay? Para ibigay mo dun sa mother. Kahit yung mga medications. Okay? Iba rin kasi kapag nakasulat. Okay? Last part, principles of integrated management. Okay? Examining so this is just the last review. We examine the child for danger signs or very severe disease. Assess for main symptoms. Routinely check, okay, limited clinical signs, then classify if pink, yellow, or green, then essential drugs, okay, what they call this, pink, yellow, green, implement the treatment, limited number drugs, then counsel the caregiver. What are we going to do immediately, and the difference of when to return for follow-up, okay? So that's it, your IMCI chart.